Hi, my name's Chloe. I'm a second year student occupational therapist and I'm looking to understand more about allied health professions in a mental health setting. And I'm here with Carly.
Thank you, Chloe.
Could you tell us a bit about yourself?
So I'm Carly. I've been a qualified dietitian for the last 16 years. I'm currently on secondment with Health Education England as their AHP Clinical Fellow for Mental Health, Learning Disabilities and Autism. When I'm not on secondment, my usual role is split. So I'm part-time Head of Profession for Dietetics in Gloucestershire Health and Care Trust, and I'm part-time clinical and I provide the dietetic cover for all of our inpatient mental health and learning disability units in Gloucestershire.
Wow. So could you describe your career journey so far? You know, what made you want to be a dietitian and where you went to uni?
So I qualified from the University of Surrey. I didn't have any particular aspirations to go into mental health. I applied for a Band 5 job up in Gateshead. And there were two roles on offer. One was more focused on cardiac rehab and one was mental health and oncology. And when I got the role, they asked which one I'd prefer to do, and I said I didn't mind, and I was quite happy for my colleague to choose what she preferred. She chose cardiac rehab, so I ended up half a day a week on the mental health wards, which were, the mental health unit was on the same grounds as the acute hospital, which I found really interesting. I didn't feel like I'd ever had sort of much background in that or much training in that, but it was really interesting. And at the same time, I was also starting to see patients with eating disorders in my general clinics, and felt a little bit underprepared for that. We didn't have any specialist services up in Gateshead at the time, so I linked in with the specialist dietitians in Newcastle, started to learn a bit from them, and started to really enjoy seeing that patient group. And when an opportunity came up to specialise in eating disorders, I moved into a role working in outpatient eating disorder services.
Oh, wow.
And then from there, I then moved down to Gloucestershire to support the opening of the Eating Disorders Day Treatment Unit in Cheltenham, and at the same time set up the dietetic service for the Mental Health Trust at the time.
Gosh.
So that was quite a big piece of work. And then our trusts merged, and that's where the Head of Profession role came from, which I took on just before COVID started, and then the Health Education England role came up more recently and seemed like something interesting to do. So, but I have to say, sort of, working in mental health, it's given me lots of opportunities. I've also done some private work with the Priory hospitals, been able to do an introductory practitioner course in cognitive behaviour therapy, and then I've just done a leadership academy programme as well. So it's offered lots of interesting things to do with my career.
You've definitely got a lot under your belt. So why are dietitians so important in mental health?
I think there's two elements to that question. What you find is that as people's mental health deteriorates, it often has a really significant impact on their nutritional intake and their eating patterns. So, if you think about somebody with psychosis who's quite paranoid around food, someone with depression who struggles with the motivation to eat, with self-neglect, somebody who starts on antipsychotic medication and the impact of that on weight gain and metabolism. Somebody who's restricting as a means of self-harm, or somebody who's forgetting to eat because of a dementia. Lots of different reasons why it might really negatively impact someone's nutritional intake. And having somebody who's there to focus on that element of the patient's care and make sure they get the right support so that it doesn't significantly impact on their physical health or their mental health whilst they're with us is really important, because obviously otherwise you can see a significant sort of deterioration in function for somebody because of that. And then you've also got the side whereby anybody coming into a mental health inpatient unit will have the same physical health comorbidities
Yeah.
as the rest of the population. So, you know, that they will come onto the ward and they might have irritable bowel syndrome, or be on an enteral feed, or have renal problems, or poorly controlled diabetes.
Yeah.
And actually having people, you know, professionals there that understand those conditions
Yeah.
and can support the patient and support the staff
Yeah.
team to understand those conditions is really, really important, obviously, for us managing people's physical health whilst
Yeah.
they're with us. Obviously those links with catering to make sure that we're providing the right food for people.
Educate people, not just
Absolutely.
the client, but
Yeah.
also
The client and the staff
Yeah.
team. And you know, often people were managing those conditions really well themselves in the community, but when they're acutely unwell, they're unable to do that. So they need us to take that on to some degree. But also, you know, a lot of people aren't accessing support in the community in the same way that perhaps people without a serious mental illness would.
Yeah.
So it's an opportunity often, you know,
Yes.
where somebody hasn't been for a diabetic review for the last 3 years, to actually be able to sit in a room with someone and say, should we have a chat about your diabetes and how it's going?
Yeah.
And take that opportunity whilst they're with us.
Yeah, that's amazing. What professions do you work alongside?
Yeah, so working with other professions has been really important for me, because for a significant proportion of my career I've been not only the only dietitian in my team, but in my whole mental health trust.
Oh, wow.
So I've needed to reach out to colleagues a lot. And yeah, work within a really kind of varied multidisciplinary team.
Yeah.
So on any one day I might be speaking with my speech and language therapy colleague about a person with dementia and dysphasia,
Yeah.
and thinking about how to ensure that they're eating safely
Yes.
and a nutritionally adequate diet. I might be working with physiotherapy, thinking about perhaps a patient with disordered eating, low body weight, high risk of excessive exercise, and thinking about an activity plan
Yeah.
that's both safe and helpful for engaging them in activities.
Yeah.
I might be working with my occupational therapy colleagues if I'm doing a piece of work around increasing somebody's diet. They might do some cookery sessions, for
Yeah.
instance, and link in with some of the things that we've discussed. I'll often speak with my psychology colleagues if I'm having some issues with sort of the dynamics
Yes.
of a relationship I've got with a patient, and having someone objective to kind of help me with that. And obviously with my nursing colleagues, they're there day in, day out with
Yeah.
the patients, and they're able to give you some amazing feedback, and also they're, you know, instrumental to any care plan you put in place in making sure that that works on a day-to-day basis. So yeah, all of those colleagues are kind of essential to making sure that
Yeah.
anything I do fits into the bigger the
Team
bigger
approach,
picture.
yeah.
Yeah.
What would you say to someone who wants to look at working in mental health?
So from a dietetic point of view, I think I would say it's a really exciting time to be thinking about working in mental health. You know, there's a big drive to improve eating disorder services at the moment. A lot of dietitians really enjoy and value working in that setting. There's a lot of work going on in understanding more about the gut-brain axis and the role of the microbiome in mental well-being, and I think there's a lot to be explored around that area. And there's a lot of work going on around health inequalities and, you know, increasing the parity of esteem between physical health and mental health.
Yeah.
And obviously nutrition plays a massive role in that.
Yeah.
So I think it's a really exciting time to be looking at you know, nutrition and mental health.
Thank you very much for coming here today.
Thank you, Chloe.